As parents, I think most of us share one thing: to give our children the best possible start in life. Unfortunately, today's rates of chronic health conditions are affecting our children immensely, from allergies and asthma to ADHD and autism. Is there anything we can start doing now to support our children's development and health before they're even born? This is for expecting parents and those planning to conceive who want to take a proactive approach to their baby's health and development, particularly those concerned about the rising rates of developmental and chronic health challenges in our kids. We're going to explore the crucial role of the nervous system in your baby's development and how understanding this connection can help you make informed decisions about your pregnancy journey. You'll learn about the concept of the perfect storm and practical steps you can take to support your baby's optimal development. At LHW, so many moms come in with a very similar story: fertility challenges, stressful pregnancy, induction epidural, vacuum, C-section, baby's colicky, digestion, sleep struggles, latch, anxiety, depression. It's a very similar cascade of events that lead to what we call the perfect storm. So how did we get here? Let's look at some perinatal statistics. Our country is first in emergency, but last in maternal and infant mortality rates. U.S. spends over $50 billion on childbirth each year, and U.S. fertility clinic services market was valued at nearly $8 billion in 2022 and projected to reach nearly $17 billion by 2028. 25% are induced. 3/4 of the women receive an epidural during labor. 1 in 3 American women undergoes a C-section, despite the World Health Organization's recommending a rate of no more than 10 to 15%. 1 in 7 women experience postpartum depression. Obviously we can't control everything that happens during a birth, and some scenarios really are emergencies, but what can we do as moms to help with these stressors of pregnancy and birth? Many think that it's hormones, so we're going to take a step back and talk about what controls every system. The nervous system. It's the foundation for growing healthy babies, and there's 2 branches. First, we have the sympathetic nervous system, or fight or flight, which is activated in times of stress or perceived danger. It prepares the body for action by increasing heart rate, blood pressure, muscle tension. Then we have the parasympathetic nervous system. This is resting, regulating, it's our digestion response. It promotes relaxation and healing and restoration. It slows the heart rate, it enhances digestion, and supports immune function. In a healthy individual, both sides are working together, allowing the body to respond appropriately to different situations. When the nervous system is imbalanced, it can lead to a state of chronic stress, and that's chaotic. Dysregulation can lead to many hormonal imbalances, such as painful menstrual cycles, fertility challenges, irregularity. When the body is stuck in a state of chronic stress with an overactive sympathetic and underactive parasympathetic, it disrupts the hormonal balance necessary for conception and healthy fetal development. This is where the concept of HPA, which is the hypothalamic pituitary adrenal axis, and then we also have the HPG, which is the hypothalamic, tongue twister, pituitary gonadal axis, and this is where it all comes into play. HPA axis is activated in times of stress, releasing cortisol and other stress hormones that can interfere with reproductive function. The HPG axis, on the other hand, is responsible for the production of reproductive hormones like estrogen, progesterone, and testosterone. When the body is in a state of chronic stress, the HPA axis can override the HPG axis, making it more difficult to conceive and maintain a healthy pregnancy. Both pathways are super important, and one isn't greater than the other, but our bodies have to know when HPA is needed and when we should be in rest and digest state. The problem really occurs when our bodies are stuck in fight or flight, when a bear isn't necessarily chasing us. Mom stress and its role on fetal autonomic nervous system development. So how does HPA and HPG affect a baby during pregnancy? The umbilical cord not only serves as a pathway for nutrients and oxygen, but it is also known as the power cord that connects the mother's nervous system to the baby's. This means that the developing baby also feels any stress or emotional challenges experienced by mom during pregnancy. Mom's nervous system is sending a blueprint through the umbilical cord for baby's nervous system to learn from. High levels of maternal stress can alter fetal neurodevelopment and lead to various health challenges later in life. When a mother experiences chronic stress, her sympathetic nervous system is constantly activated, and this stress is transmitted to the growing baby's nervous system growth. So in utero, we have first trimester. In week 3, we have the nervous system is beginning to form. Weeks 5 through 8, we have major organs that are developing. Week 6, we have the sympathetic nerves involved in social development beginning to form. Second trimester, weeks 13 through 16, bones and muscles develop. Week 17, cerebellum begins to form. Week 26, the vagus nerve myelination occurs. Third trimester, from weeks 29 to 32, immune system develops. And from 33 to 36, rapid brain development occurs. So by week 37, autonomic nervous system is fully developed, and week 40, the vagus nerve and immune system are fully mature. Subluxation and dysautonomia. So where do we come in and how do we help as chiros? Some potential effects of subluxation and dysautonomia during pregnancy include hormonal imbalances, fertility challenges, heightened stress response and difficulty relaxing. This impairs blood flow to the placenta, suboptimal fetal positioning, breech, transverse, increased risk of complications during labor and delivery. So we have some tools for growing healthy babies. Obviously, we can't control everything, but we can set our bodies up to be the most educated, resilient, and adaptable to anything that is thrown our way. During preconception and pregnancy, we have the power to create an environment that supports baby's development from the very beginning. One of the most important steps you can take is to educate yourself and prepare for the journey ahead. Start by prioritizing preconception care for both partners. Optimize your physical, mental, and emotional health through proper nutrition, exercise, stress management, and nervous system support. By laying a strong foundation before conception, you can increase your chances of having a healthy pregnancy and ultimately having a thriving baby. You can build your circle, surround yourself with a supportive birth team and environment. Choose healthcare providers who align with your values and priorities and who will empower you to make informed decisions about your care. Lean on us if you need that direction. Consider working with a midwife, doula, pelvic floor PT, a lactation consultant, as well as your prenatal chiropractor. Birth professionals are here for your guidance. You need to advocate for yourself. They need to help advocate for you during this the whole process. So now that we've talked through all of these amazing things, I hope that you can truly see the impact that we can make on our growing babies. How cool is it that by focusing on nervous system development, we have the ability to affect our growing babies' development even before they're conceived? The foundation of nervous system health starts with neurologically focused chiropractic care, which can offer specific benefits such as improved nervous system function for both mom and baby, reduced stress, enhanced immune function, and optimal fetal positioning. Let's start by seeing what you and your partner's nervous system looks like. At LHW, we test through the technology called neurological insight scans. They're non-invasive and show us how your nervous system is functioning and where it may need some help. From there, since all nervous systems are unique, you'll receive a customized care plan that is tailored to exactly what your nervous system needs to heal and be ready to grow that healthy baby or just be your healthiest self. So don't just wait until after your baby arrives to think about their neurological health. Contact us today to learn more about how we can support you in giving your baby the strongest possible foundation for their start to life. Visit the link in our bio for more info. Share this video with a friend who needs it.